So I wanted to talk real quick about UTIs. I thought I had one, and I never had one before. Didn't know what to do. Over the years, plenty of women that I know in my life have had urinary tract infections, some recurrent, some frequent, once a year kind of deal, and they just get hit with antibiotics. Usually eradicates them pretty well. But antibiotics definitely have their place if you can use something that is commensurate and has just as much efficacy without the side effects and the microbiome damage. I would always at least suggest that first. It just kind of makes common sense, right? So I went immediately and bought some D-mannose, and I think it was combined with 400 milligrams of cranberry juice extract. Now, when you look at the literature, there have been plenty of studies, and there was, I think, a 2022 cohort where they basically assessed the efficacy between D-mannose versus an antibiotic, and they were similar results, basically. About 10 days, you should take the D-mannose. What happens is it basically has an affinity to the bacteria, specifically E. coli, and that constitutes about 80% of UTIs. So I would still get a urinalysis done or even have it cultured so you know what kind of bacteria you're dealing with before you hit it with anything. But if it is E. coli driven, D-mannose is a very, very favorable alternative with similar results. And that simple sugar seems to adhere to the protein in the bacteria. And they basically have an affinity for one another, kind of lock horns. And as you urinate, it passes them harmlessly out the bladder. And that kind of is the mechanism of action, if you will. I wouldn't use it long term. There is some research to say that this monosaccharide sugar can, be a little deleterious to the liver if you just did it indefinitely. But for short term use with almost no side effects and it's cost effective, maybe you should give it a try. All right.